tonight.
Now is the single best time and best opportunity to defeat Obamacare.
We are done.
Repealing the Affordable Care Act is wrong. It was wrong the first time. It is wrong the 31st time.
If the president's not going to implement the law, we're not going to fund it.
Welcome to Groundhog Day in the House of Representatives.
This law is not working. You'd have to take Republicans' word for it, and you can take Democrats' word for it.
The House this week is going to vote for the 40th time to repeal the act. You aware of that?
Wasting the country's time by taking something like 40 meaningless votes to repeal Obamacare is not a jobs plan. That's not a jobs plan.
President Obama will scream and yell that the mean, nasty Republicans are threatening to shut down the government. And at that point, we have to stand up and win the fight.
And welcome to Hannity. It is considered the cornerstone of the president's domestic policy agenda, and now the debate over Obamacare has returned to the forefront of American politics. Now, efforts to defund the controversial law are now raging on Capitol Hill. Doctors are threatening to close down their practices. Many business owners, they're facing an uncertain time and future thanks to the mountains of new and very costly regulations. And with all that in mind, tonight, for the hour, we have assembled a studio audience of doctors, healthcare executives, political commentators, business owners, and much more. Now, some support Obamacare, others are staunch opponents of the law, but over the next 60 minutes, we are all under one roof right here in our New York studios, and I'll welcome you all. Welcome aboard. Thank you for being here. All right, now, Steve Forbes, you are one of the best money men in the country. You understand the finances of this. Will businesses really not be able to hire full-time workers? Are they cutting back on full-time workers as a result of not wanting to meet that 30-hour requirement?
If you're a small business, absolutely. Your margins are small, therefore you don't have the ability, if you have a large profit margin, to do this. And in the face of uncertainty, you hold back and see how actually this thing is going to unfold. Bigger companies, our company is suddenly facing taxes this year and next year that we didn't really know about, and now we're learning about it. So everyone is getting hit by unanticipated costs and just sheer uncertainty, and that hurts hiring.
Who wants to comment on the actuaries that have determined it's going to go up? You want to, in California, 164%, 88% in Ohio.
Well, the actuary, Sean, is a big deal because when you look at how the law was calculated, and that's why you need to put the brakes on, the unintended economic consequences of Obamacare are a disaster. What employers are doing to switch to part-time, what insurance companies are doing to raise premiums and game the system, what doctors are doing to reject Medicare, and what ACOs have now failed in the experiment, all of the assumptions on which the law was passed, saying that it's actually going to save money, are completely flawed. So the CBO needs to go back and recalculate that because the economics are wrong math.
Well, the original estimate was $900 billion. Remember, the president tried. The latest CBO number that I saw was $2.8 trillion. The number's going higher. Is that a broken promise?
Well, here's the thing. We really need to go back to this point about the actuaries, because the law is called the Affordable Care Act, but it drives up the cost of insurance by a dramatic amount. In states like California, in Texas, and Florida, in nearly every state in the union, the cost of individually purchased insurance is going to go up by 40, 50, 100, 150%, depending on the state.
160 in California, right, Betsy?
That's right. And why is it going up? Because these premiums are going to include $100 billion in taxes. When you write that check for your premium, a lot of it's not for your health care. It's for new tax hikes.
Phil?
Well, look, Sean, the bottom line is this bill is not ready, okay? That's why they delayed the employer mandate. That's why they delayed the employer reporting requirements. They've already scrapped things like the Class Act, big elements of this bill. But the heart of it are the exchanges. They're not ready to go. They want to force people to buy insurance from a system that is going to be a complete and utter mess. There are 12% of Americans who think keeping the employer mandate intact for next year is the right thing to do. The overwhelming majority either want it repealed or they want it delayed for 1 year. This is a president who got elected saying we hate the 1%, I'm for the regular guy, I'm for fairness. What could be more fundamental fairness than to give the same relief, the same 1 year delay to small businesses and individuals that Obama gave to the giant 1% corporation?
Isn't the bigger question, how many here would support Congress and the Senate, Mike Lee's effort to defund? Hands up. How many are, Steve Forbes, I don't see your hand up. You're surprising me.
I believe they should try the defunding, but I don't think they should go to the wall on it, because I think Obama wants to have a government shutdown in his campaign to rule by decree and discredit Congress. So I hope they get their tactics right on.
Steve, what I'm surprised about with you is if Republicans don't fight on this and there are political considerations, what do they stand for?
No, it's not fighting. It's how you fight.
Okay.
In a way that you set the foundation to win this thing in 2014 and remove its legitimacy. The House finally is going to do some things right. They voted on the employer mandate. They voted on the individual mandate. Now they're going to go after the IRS, pass these bills, send them to the Senate, have the Senate reject them and say, here's what they want, here's what we have. Do it right. There's also a very interesting lawsuit coming out of Oklahoma. The bill says the the government cannot give subsidies to people on exchanges unless the state puts the exchange in it, unless the state puts the exchange in itself. So 34 states haven't done that. That, in effect, defunds the whole thing. Support that Oklahoma lawsuit.
That's a choke point I've been involved in.
Let's hear it. Go ahead. Yeah.
And also in the D.C. Federal District Court case. If you can topple that and take away the manna from heaven are the tax credit premium assistance payments. If Obamacare doesn't have that, it can throw everything else over the side. It can throw away mandates. It can throw away all the rules. But if it can't deliver the bucks to people, that's where it dries up. That's a choke point in an end game. The problem with defunding is don't take a hostage if you're not ready to shoot it.
Grace Marie, go ahead.
Well, this law is just not ready for prime time. You've got one of the things they most wanted to do is to get young people enrolled in the exchanges. That's why the president's talking about getting the NBA and the the football players.
$700 million we're going to spend on advertising?
To tell us how much we should love Obamacare. But people are going to find out what this law means. But that's what's happening with small businesses. They're having to put people on part-time to avoid the fines. But individuals, especially healthy young people, when they see the size of the premium that they're going to have to pay for health insurance, and they're going to say $3,000, $95 for a fine,
take the
give
fine.
me a break.
Well,
and so you're going to
first of all, these young people are home anyway because they don't have jobs.
They don't have jobs. That's exactly
And their moms
right.
and dads would love to get them out of the house.
But these are the very people you need in these exchanges.
As a flexible staffing industry person, the temporary help industry is growing, of course, quite rapidly because of the uncertainty that's out there. Businesses are not going to hire people on a permanent basis. This is good for your business. Pardon?
This is good for your business.
It's good for our business, but not good for America. And that's the important thing. Are we more interested in our business or America? I'm more interested in America than I am in our own business. But 94% of all the companies, over 50 employees, had health insurance. So there's only 6% of them that was going to affect anyway. We have health insurance with our company for every temporary associate.
Well, we really haven't had for decades, and that is real free markets in healthcare, like we have in food, turning scarcity into abundance. And that means to have real free markets and real safety nets like we have with food.
Crossing state lines.
And Sean, if we had good health care, we wouldn't have to force people to buy it. You wouldn't need a mandate if it's worthwhile for people.
We were talking about patient savings accounts, individual accounts, free markets, go in line, I think, with what Mr. Forbes was saying.
You keep it simple. You allow people to spend money where they think it needs to go. This is all about telling people what's good for them and directing them to do it, as opposed to opening up. We can subsidize some people, but we didn't have a market to actually supply it. But we're way too pessimistic about this. Look at all the pieces of Obamacare that are falling off. There are at least a dozen major provisions that have either been delayed, deleted, or disguised, and there's a disharmonic convergence of everyone where they find one reason or another to be opposed to this. If we can stay at this long enough, all the wheels will come off.
And the destruction that it's doing, not just to our health sector, with doctors leaving the practice in droves, but also to what's happening to the economy. Small business owners have told me that just paying the fine for not purchasing Obamacare insurance is, well, it's bigger than their profit margin. We might as well close our doors, then everybody loses their job.
When did we ever get to a point where the government creates a disincentive for people to hire full-time workers at a time when America needs them more than ever? Yeah, it's right up here. Go ahead.
One thing I want to mention is that, you know, with this Lee Cruz bill, this idea of shutting down the government to defund Obamacare, it's not the right strategy. The right strategy is to delay the subsidies for a year. As Grace Marie said, the law isn't ready for prime time. The exchanges aren't going to be...
I got to interrupt you, though, quickly, and I'm going to give you your time.
Sure.
That is not what Senator Lee's saying. Senator Lee's saying fund the entire government, defund Obamacare.
Right.
That's not shutting down the government.
Well,
that would be the president's choice.
But the Senate is not going to pass that. The president's not going to sign it, and the result will be a shutdown of the government that will be profoundly unpopular and set back Republicans. But if you delay the subsidies for a year, then the real cost of Obamacare will come out because the premiums will go up, people won't be insulated from the subsidies, and there's going to be a lot of fraud because what the IRS has done, what HHS has done, said we're not going to verify your income, we're not going to verify your eligibility.
If this takes hold, name me a big government program that has ever been given and taken away.
And that's why the subsidies, that's why you got to delay the subsidies.
You guys have been great. Give yourselves a big hand. Thank you very much.